Welcome to the show. Some people live long and full lives with mild valvular problem and never require surgery. But once a heart valve begins to affect the heart's ability to pump blood, it's likely to require a repair or a replacement. Treatment for valve disease will include a plan to protect your heart from further damage. Assess your need for medication to help manage symptoms, repair the valve problem if it's needed, and manage steps for self-care and follow-up care. Today, we will speak with Dr. Daniel DiBardino, a heart surgeon in the Mercy system, about the valvular heart disease and new surgical options available to patients. Are prescription drugs add on TV driving you crazy? Even doctors have reached their limit. You have seen commercials for medications I hope you will never need. Many patients are more confused than ever before. This is why you must ask good questions when a medication is prescribed to you. If you go to ToledoCardiology.com, I have prepared a list for you to take to your doctor, because time waits for no one.
You're living a full and productive life because you've always committed to giving the best of yourself to everything you do. And there's so much to look forward to: children's weddings, the second honeymoon, your philanthropic work, just to name a few. The dedicated physicians at Toledo Cardiology Consultants are committed to your cardiac excellence, so you'll be there for the experiences of your lifetime that are yet to come. To learn more, visit Toledo Cardiology at ToledoCardiology.com. That's ToledoCardiology.com.
At Ballast Buick GMC, you can make luxury your reality in an all-new 2017 Buick LaCrosse, designed for the ultimate quiet and luxurious driving experience. Or picture your family in a luxurious, roomy SUV, complete with DVD system, heated seats, and a 4G Wi-Fi hotspot. Choose from the popular compact Buick Encore to the gorgeous Buick Enclave. We invite you to browse our website, ballastbuickgmc.com, or stop in soon. Remember, at Ballast, you are family.
Life is filled with uncertainties. Your career, your health, your family situation, they're all subject to change. So how can you plan for your future when you don't know what it will hold? The Root Prisby Williams Group of Financial Advisor team at Morgan Stanley can help. Joel, Jim, and Deb will work with you to create a wealth plan and to help you manage your investments through all the changes. And the great thing is they're right here in Northwest Ohio. To make an appointment with Joe, Jim, and Deb, call 419-842-6505. Investments and services offered through Morgan Stanley Smith Barney LLC, member SIPC.
Honey, do you remember this mole being there before?
No, I don't. We better get that checked out. I'll call Renaissance Dermatology.
Didn't they treat your eczema?
Yeah, but they can handle the full spectrum of skin conditions. They can screen to see if it's a problem, and if it is, they can handle the surgery too.
Will it take long to get an appointment?
No, Renaissance Dermatology is timely and efficient. That's why I trust them.
Sounds like they know what they're doing. Go ahead and call.
5951 Renaissance Place in Toledo. Call 419-824-2288 for an appointment. Renaissance Dermatology.
Sitting is the new smoking. From the office chair to the car and then the couch at home, people are spending too much time sitting, and it's hurting their bodies. Researchers have found that sitting is more dangerous than smoking, and we are sitting ourselves to death. The solution? Move more, play more, dance more, make love more. Find ways to get 10 minutes of movement as many times as you can a day. Remember, time waits for no one. Dr. DiBardino, would you explain to us what is TAVR?
So TAVR is an abbreviation for transcatheter aortic valve replacement, and it's basically a very minimally invasive way to replace the human aortic valve.
How does the TAVR differ from the conventional valve replacement?
So the tried and true conventional method is still where we have an incision and we go into the chest and physically replace your valve with a valve that comes off the shelf. That requires a major open heart surgery. It's very safe and effective, but it is more invasive. So TAVR is different because it's done essentially without an incision in most cases. So it's a much more minimally invasive way to actually replace the same valve without an incision.
How does this procedure work?
So the vast majority of the time, the team accesses what's called your femoral artery, which is the artery in your leg. And we go up through your aorta with a wire, and we're able to then pass the TAVR valve over that wire into your aorta and inflate it in place without using a true surgical incision.
Can you tell us what type of patients are qualified for this procedure, TAVR?
Well, many patients are eligible. It's not for everybody. Patients who are older and typically over the age of 70 that are a little on the frail side and maybe wouldn't do so well with surgery, or even younger patients who have complicating factors in their case that make surgery a little more risky, we would consider for the TAVR procedure instead of the traditional surgical approach.
What is the expected recovery time for someone who has this kind of procedure, which is the TAVR?
The patients who have transcatheter aortic valve replacement, TAVR, are usually only in the hospital with us for about 3 days. So it is a remarkably shortened recovery time, of course, because you're not dealing with the surgical incision.
Can you tell us how long before the patient can get back to basic exercise such as jogging, walking, or elliptical machines?
So patients who have the TAVR procedure are with us in general for 3 days in the hospital. After discharge, because you're not dealing with some of the restricting issues that come along with conventional surgery, patients are often able to return to what they consider to be their normal active, healthy lifestyle within days to weeks.
What are the risks and complications for anyone to go through this kind of procedure, the TAVR?
The take-home message about the risks and complications is that there's always a risk of having complications with any procedure, no matter what it is. But relatively speaking, the risks and complications from TAVR are on the lower side than they would be for conventional surgery, because you're not dealing again with the incision and some of the invasiveness of the traditional surgery. So for example, for renal disease, if you have kidney disease, your risk of kidney failure would be lower after this procedure than it would be for surgery. So if somebody comes to us and needs a valve replacement with a lot of kidney disease, they would be somebody we would consider for the TAVR approach, just to give an example.
How will the new aortic valve function after this procedure? Can you explain it in summary?
So the good news with TAVR is that the valves are very effective. And so once they're in place, if everything goes well during the placement and the procedure, the valves actually function very well. When we see the echoes, we see the same kind of hemodynamics and result that we see with traditional valve surgery, at least initially.
What about how long the patient can expect their TAVR valve to last?
So one of the downsides of TAVR, everything has a downside. One of the downsides with TAVR specifically is that we don't really know a lot about the durability at this time, because it is a relatively new procedure. And that's one of the reasons why traditionally TAVR has been advocated for older patients that don't have to see that valve function for 20 or 30 years down the road. So we're still working out what is the durability, but we know that for patients in their late 60s and early 70s that are appropriate candidates, that so far we're seeing results that are appropriate for that age category.
Can you tell us also what is the expectancy of a valve for someone who had the traditional valve replacement surgery?
So that's why we still advocate traditional surgery for younger patients, because traditional surgical valves can last a lifetime.
Another question, does the TAVR procedure require the patient to have a general anesthesia?
So one of the tremendous advances that's been made with TAVR is that it can be done under just conscious sedation, which means you don't have the breathing tube and you don't have the true general anesthetic approach that's still obviously required with major surgery.
What about the length of this procedure? How long is this procedure expected to be on average, and who is performing this procedure?
The procedure takes approximately an hour or two from skin to skin total time. The TAVR procedure is performed by a team approach. It's known as structural heart team. So you have an interventional cardiologist. There's a surgeon there assisting as well, myself or one of my partners who's an active assistant in the procedure, and many other team members that are around manning the equipment and performing echocardiogram and performing the anesthetic portion of the procedure at the head of the bed. So it's a large team that it takes to perform the procedure, and that's why it's important that you have it in a place where you have a whole team of experienced people.
What about to tell us a little bit about the experience our Mercy team has been able to develop with this program, the TAVR program?
So we've had an active TAVR program now going on 2 years. We're well over 100 procedures into our experience. So at this point, everybody on the team is very comfortable with the approach. We have different troubleshooting techniques for things that occur along the way. and complications that can arise. So at this point in our experience, we're very proud to say that we have an experienced team and a team that can handle the most complicated cases.
Now moving to another subject, what is the mitral valve?
The mitral valve is the main valve that guards the left ventricle. So it's where the flow comes into the ventricle right before it gets ejected out to the rest of the body to supply all of your organs. So it's a very important valve. It has to function properly for you to stay healthy and for your heart to stay healthy.
And how are the doctors able to tell if someone has a mitral valve regurgitation or leakage could require treatment?
Right, so mitral valve regurgitation is a common disease, and we're finding it more and more frequently as patients undergo more echocardiogram procedures. So when you have mitral regurgitation, which simply means a leaky mitral valve, as that gets worse, you will have symptoms. The predominant symptom is shortness of breath. Also, you can't walk as far as you used to. You have to sit down and take breaks. These are the common things people describe. When you become symptomatic and/or your echo shows severe leakiness of the valve, it's time for an intervention.
What are some of the symptoms people might have if they are suffering from mitral valve disease?
So unfortunately, it's very common for patients to ignore the symptoms of valve disease. It's a little more difficult for people to ignore chest pain that you get with coronary artery blockages because it can be very debilitating. But patients can hide from their symptoms with valve disease because the main symptoms are shortness of breath, what we call dyspnea on exertion, where when you try to walk across the room, you become profoundly short of breath. Maybe you have to sit down and take a break. Maybe you can't walk through the grocery store like you used to, or make it up a flight of stairs. And when we see these things, that's when we know that there has to be something causing the problem. It's a change for you. So rather than ignore it, the best policy is to address it head on so that you can have the maximum number of interventional choices depending on what we find the problem actually is.
Can you tell us a little bit about the mitral valve clip procedure?
So the mitral valve clip procedure is an alternative to traditional mitral valve surgery where a wire is placed up into the heart through one of the vessels in your groin through a minimally invasive approach, and using that, a little device called the mitral clip is attached to the valve to reduce the leakiness of the valve.
How is the decision made for someone to be deemed a candidate for the mitral valve clip?
So that decision for mitral valve surgery versus clip has to be made by a group of people that are experienced treating mitral valve disease. So that would consist both of an interventional cardiologist who's a structural heart specialist and also a cardiac surgeon like myself who is a structural heart specialist. We together decide which therapy, either surgery or mitral clip, is appropriate for certain patients depending on all of the other factors in the case, including age, overall comorbidities, a lot of other factors that have to do with your own personal health history.
What is the mitral valve clip device made of? How does that help to reduce the mitral valve regurgitation or leakage?
So when you see the mitral clip device by itself, it looks like a tiny little staple remover. Everybody's seen and held a staple remover. When you, in the open position, it looks open, and when you close it, the little teeth come together. That's exactly what the mitral valve clip looks like. And the way it works is the mitral valve has two leaflets. So imagine taking a little staple remover and putting it on the valve so that the little teeth on each side bite the leaflets, and then it closes, squeezing them together. And that reduces the leakiness of the valve.
Who are the patients that should not have a procedure like mitral valve clip?
Yeah, so the decision for mitral valve clip placement versus surgery has to be made by both your interventional cardiologist and your cardiac surgeon. So patients are candidates for procedures based on their individual situation. Some patients would not be candidates for the mitral clip and would have to undergo traditional mitral valve surgery with me, or some patients are candidates for the mitral clip depending on their anatomy of the valve, and they would be appropriate for mitral clip placement.
Does having the mitral valve clip procedure require anesthesia, and how long is the procedure like this expected to last?
So the mitral valve clip procedure, unlike TAVR, does require a general anesthetic and the breathing tube, as does traditional valve surgery. The mitral valve clip procedure does take longer than TAVR for many reasons. It's a more difficult procedure from an anatomic standpoint, and it also just takes longer because of the design of the technology. So this procedure can take up to 4 to 5 hours at times. I would say 3 to 4 hours might be a general range of where we would quote today.
Can you tell us who performs such a procedure?
So the mitral valve clip procedure has to be performed by a team, the structural heart team, which is a group of people who are familiar with the device, familiar with the technology, and are able to work as a team approach in a room like this to be able to apply the clip. It consists of an experienced interventional cardiologist, a cardiac surgeon that's experienced in mitral valve procedures such as myself, and many other people, including the technicians, the anesthesiologists, the echocardiogram techs, and everybody that it takes to run the room around the patient to make it all work.
What are some of the complications a patient can develop from this procedure?
The main complication with the mitral valve clip procedure is simply that it doesn't work, and that the mitral valve regurgitation continues, that the valve still leaks. And if that's the case, we would have then moved to traditional surgery as an option, just like you would have if you had not had a clip procedure.
How severe does the patient's symptoms has to be before surgery is considered?
Well, that's interesting. Some patients can be symptomatic with a moderate amount of leakiness. Some patients have a severe amount of leakiness and they say their symptoms aren't so bad. The experience of having symptoms is very personal, and it's based on each individual's tolerance for their activity levels and their own perception of their disease. We take both the symptoms and the echocardiogram pictures of the severity of the regurgitation into consideration when we decide who and when to intervene on.
What sort of medications are available to a patient who might just be opposed to any type of surgery?
There are medications to treat mitral regurgitation, mitral leakiness, if you will. But what we find is that medications have their limitations. And although we always recommend medical therapy as a first line of treatment, what we find is that many patients that have severe leakiness, even on medications, will come back to us and require treatment.
Can you tell us what is the recovery time for this procedure? It's minimally invasive, so can someone get back to their lifestyle in a short amount of time?
So most of the mitral valve clip patients are patients, as you're describing, who are otherwise have been active, who want to get back to their lives. And for these patients, the recovery is actually remarkably quick. So patients stay in house overnight, maybe 1 or 2 nights at the most, and are often discharged on day 1 or 2 with very little in the way of restrictions, because with a minimally invasive procedure, again, we're not dealing with the surgical incision and some of the other issues that go into conventional heart surgery.
Who is the Mercy team behind the mitral valve clip? Why should this team be considered more of the expert in this field?
So the mitral clip procedure is only offered by very few programs in the greater Toledo area. We are one of them. We're proud to be on that list, and it has to do with the depth of our team, the interventional cardiology and cardiac surgery experience with the mitral valve that we have. So we're quite proud to be able to offer a team that can perform this procedure safely and to offer it to many patients who may not have been candidates for procedures in the past because they wouldn't be surgical candidates.
So we have talked about 2 different procedures. The people out there might want to know what type of medication they might have to be on following either one of them.
Many patients who have these TAVR and MitraClip type procedures do require anticoagulation in order for their blood products not to stick to the devices. And so that would be then, in general, a lifelong medication that would be required, the degree of which and the actual specifics of which depend upon the procedure that you have.
If there's any sort of physical therapy required for anyone who had this kind of procedure we have talked about?
Well, minimally invasive procedures do require a lot less intensive recovery time than general surgical procedures do. But in general, patients with a lot of comorbidities, for example, joint problems or back problems or difficulty getting around for other reasons, can always benefit from some physical therapy after any procedure.
So you had mentioned that at this point, mostly older candidates are having the TAVR procedure based on the lack of research into the TAVR longevity. With Mercy being a leader in the TAVR procedure, are there any steps being taken to try the TAVR on the younger candidate and Mercy doing its own research into this longevity?
That's a complicated question. The decision to place TAVR in younger patients is actually not ours to make. I mean, these things are taking place at the FDA level. These require national and multinational research registries and protocols, which are currently in place to describe exactly what the longevity of this valve will be. We do not know what the longevity of this valve will be, especially in younger patients. And we always recommend for younger patients that can have surgery, that the traditional surgical approach be used, because it is the standard of care until those questions are answered at an international level.
Now tell me, considering your years of experience, tell us from your point of view what you think of the advancement in technology to provide this type of care to patients.
These are technologies that are currently being used in patients safely every day, which we had not even conceived of even just 15 or 20 years ago. In the case of the MitraClip, even 10 years ago, this technology just simply didn't exist. What maybe is more exciting than the fact that we're doing these in elderly, inoperable patients now is the fact that it's opening the floodgates for the technology which 15 to 20 years from now may eliminate conventional surgery entirely.
Do you think these advancements are providing older patients who might not have withstood traditional surgery a chance for a new lease on life?
Yes, patients that previously had no options for treatment now have options for treatment because of both TAVR and MitraClip.
If there's anything, procedure or technology you see on the horizon that will advance this type of care further?
I believe that the technologies which are being developed by the companies that currently make our TAVR and MitraClip procedures, Abbott Medical, Edwards Life Science, all of the companies, Medtronic, that are involved, their think tanks are currently developing the next gen technology. We've only seen glimpses of it, but it will change the way cardiovascular medicine is practiced in the next 2 decades.
Great. If there's anything else you would like to add for us?
It's gratifying for me to be able to, as a surgeon, participate on both sides of this technology, and that's why I chose my niche in structural heart team approach, or structural heart surgery, if you will, to be able to work side by side with the interventional team to be able to be part of this, because it's an exciting time in cardiovascular medicine and surgery.
Dr. DiBardino, thank you so much for your time and your expertise.
You're living a full and productive life because you've always committed to giving the best of yourself to everything you do. And there's so much to look forward to: children's weddings, the second honeymoon, your philanthropic work, just to name a few. The dedicated physicians at Toledo Cardiology Consultants are committed to your cardiac excellence, so you'll be there for the experiences of your lifetime that are yet to come. To learn more, visit Toledo Cardiology at ToledoCardiology.com. That's ToledoCardiology.com.
At Ballast, there are no worries. Buy a certified pre-owned vehicle from Chevy, Buick, or GMC and you're protected. Because all those 2012 to 2017 vehicles come with 2 factory-backed auto warranties that combine to provide fantastic coverage. A new, longer 6-year, 100,000-mile powertrain limited warranty and an impressive 12-month, 12,000-mile bumper-to-bumper limited warranty, both with a $0 deductible. Ballast Buick GMC on the Central Avenue Strip and ballastbuickgmc.com.
Every day you listen to the news, but how is that news affecting your financial world? Things like your retirement and your kids' college fund. You need someone who can help you work towards that goal. Someone to help you move forward in these times of change. Call the Roop Prisby Williams Group at Morgan Stanley. Joel, Jim, and Deb each have 25 years of experience as financial advisors, and their team is right here in Northwest Ohio. To make an appointment with Joe, Jim, or Deb, call 419-842-6505. Investments and services offered through Morgan Stanley Smith Barney, LLC. Member SIPC.
Ugh, I'm breaking out again.
How about I make an appointment for you at Renaissance Dermatology?
Really?
Sure. They provide a full spectrum of medical and surgical services for a wide variety of skin conditions.
Mom, you're the best.
And they can teach you about skincare and how to avoid skin cancer.
Will it take long?
Nope. Renaissance is timely and efficient. We'll get you cleared up in no time.
How do you know so much?
See a big mole on my chin?
No.
There you go.
Call 419-824-2288 for an appointment. Renaissance Dermatology.
You're living a full and productive life because you've always committed to giving the best of yourself to everything you do. And there's so much to look forward to: children's weddings, the second honeymoon, your philanthropic work, just to name a few. The dedicated physicians at Toledo Cardiology Consultants are committed to your cardiac excellence, so you'll be there for the experiences of your lifetime that are yet to come. To learn more, visit Toledo Cardiology at ToledoCardiology.com. That's ToledoCardiology.com.
Recently, there have been many alarming commercials about cardiac conditions called atrial fibrillation. AFib is an irregular heartbeat. This can sometimes be felt as a fluttering or thumping in the chest, although some people have no symptoms. And starting blood thinners is so important to avoid stroke. To diagnose atrial fibrillation, your doctor will review your signs, symptoms, medical history, and EKGs. Because remember, time waits for no one. Let's summarize it. It's important for you to understand that if you have any of the symptoms related to valvular heart disease, is to have regular checkup so any problem can be managed or fixed at the right time. Medication can be prescribed to increase the heart ability to pump blood, which may help compensate for a valve that is not working correctly. However, a diseased heart valve is a mechanical problem that cannot be fixed with the medication alone, and surgery is often needed to repair or replace that damaged valve. If the faulty valve never gets looked at until the patient realizes it's a serious medical problem, the diseased valve may have weakened the person so much that open heart surgery is needed to fix the problem, and that adds many risks. Remember, the benefit to having a minimally invasive procedure is to lower the risk of infection, less trauma to your chest and heart muscle tissue, decreasing the recovery time also. Everyone who has any types of surgery want less pain and shorter recovery time, but they also want the best possible outcome for a longer, healthier life. A person's age, health, history, types and severity of the valve problem, as well as that person's overall health, are all considered when making the decision for the best surgical option if it's needed. Bottom line, the heart team, including interventional cardiologist and a heart surgeon, cooperate on those advanced treatment with one goal in mind: determining what best for the patient, providing success and less complication. Thanks again to Dr. DiBardino for his expertise, and thank you for watching. Hopefully this episode has provided you with more information on valvular heart disease, and if you are suffering from symptoms, open your eyes to options available. Just talk to your doctor, because remember, time waits for no one.